Hello, everyone, and welcome to this webinar today. I'm not going to say good morning, good afternoon, but what I'm going to say is I hope you're in a part of the world where you're not too affected by the lockdown. I can tell you that sitting here in Italy it's been complicated. And this webinar doesn't focus on this topic, but as we might see later on, it could actually be tangential to it, and we'll be talking about how to build an integrated and digital social protection information system, focusing on outcomes, challenges, and risks in the process of getting there. Now, if we can go to the next slide, we've got a nice team of people on this webinar, and I'll introduce them to you. You can see them at the top of your screen. If we go to the next slide, I'll start with Richard, who I'm sure a lot of you know. He's a senior management information specialist at Development Pathways. He's been working on information systems for social protection for many years now, and he is actually behind the design, the development of information systems in a lot of countries, including possibly a lot of the ones that you're joining us from today. If we move to the next slide, we have Massimo Sichinga, who is joining us from Malawi. He's principal economist in the Poverty Reduction and Social Protection Division in the Ministry of Finance, Economic Planning and Development. And most importantly for us today, he's leading the technical implementation of Malawi's social registry, which is actually called the Unified Beneficiary Registry. In the past, we've talked about how sometimes names and functions don't always correspond, and he'll be giving us some really interesting insights on how some of what Richard will be talking about from a generic point of view actually applies to the Malawi context. Moving to our next guest today, we have Ralph joining us from GIZ, and he's the head of the Sector Initiative Social Protection and heading also the GIZ program on Global Alliances for Social Protection, facilitating South-South exchange and peer learning, and is also behind the SPIAC-B working group on digital social protection. So welcome, Ralph, today. And the last slide is introducing myself. I've been working on these topics also of information systems for social protection for some time, and alongside Richard doing kind of some of the thinking and conceptualizing in the background. If we move to the next slide, where the way this webinar is going to work today is we're going to have a short presentation by Richard, followed by a short presentation by Massimo. I'll be then kind of drawing some very quick conclusions and, more importantly, posing some initial panel questions to our webinar specialists. And after that, we'll be opening to questions and answers from the audience. And many of you have probably joined socialprotection.org webinars before, so you'll be familiar with this. You can, to pose a question, you just type it in the chat bar, and I'll make sure to pose the questions to our panelists today. If you're interested in this topic, there's a socialprotection.org online community that you can also go and find more information on. And also, very importantly, maybe even while you're listening to this webinar, you could have a look at the links that we provided to these two papers that we're presenting today. This paper that underpins the webinar is something that Richard and I have authored. And how is it different from what's been written in the past? It's a lot of the previous research and evidence that we've been behind, that the World Bank has done some amazing work on. They've been research focused, very much kind of trying to understand what's been happening around the world on this front. This one is more of a taking a step back, very simple, clear, linear approach to what are the building blocks, what is the vision, how do these fit together, and kind of moving beyond the ideological debate. So we hope it is helpful, and we hope that this framing will actually help us in country-specific work going forwards. Having said that, I hand over to Richard. Please. We can now all take our mics off except for Richard and our videos.
Thank you, Valentina, for that introduction. So I think in terms of the digital and integrated information system for social protection, today we are going to look at 3 key issues. I think the first one is just to ask ourselves why. Why do we need a digital and integrated information system for social protection? The second point would be ask the question, what are the main components and pillars? And finally, I think we need to ask ourselves, what are the challenges and the risks? So in terms of the rationale, in terms of the outcomes, in terms of the objectives, this could be organized in terms of 4 thematic areas. So, and on the paper, it goes into greater length and depth in terms of the explanation and the clarity, regarding the information system objectives. The key would be to understand the aggregation of this into those particular pillars and to be able to really understand the key outcomes. It's worth emphasizing that for each of these objectives, not every component or not every aspect of the information system necessarily can be achieved at any one given point. So we have, for example, inclusion, we have the inclusion, we have the efficiency, sorry, a minute, sorry. So you have the efficiency and effectiveness, we have accuracy and integrity, we have accountability and empowerment. In terms of the inclusion, I think this is very, very relevant at this particular point. When you are dealing with responsiveness and dynamic inclusion, we're talking about a time in which we need an integrated system to be able to deal with shocks and be able to deal with multiple stressors in an entire social protection arena. We're talking about coordination. Coordination means an integrated system enables social protection sector to be able to deal with multiple challenges within social protection sector and even beyond. Equity, it means an integrated system gives us the ability to be able to know that there is equitable investment of social protection programs across geographies and other administrative jurisdictions. Efficiency and effectiveness, we are looking at the challenges around, for example, reducing the burden not only to the administrators and managers of social protection programs, but also to the applicants. Reduction in terms of the paper. Sometimes some programs, for example, require more than 10 papers to be able to actually make an application. Accuracy and integrity, it means thinking through, for example, reduction of fraud with linkages to, for example, national ID system for verification of the information. It's very possible to be able to reduce the potential fraud and to be able to improve the accuracy. Most of the information system would be built with inbuilt validation controls. So when you have, for example, a mobile application with strong validation controls, it means you don't have, for example, somebody who was born in the future. So some of these things could be actually addressed with the integrated system for information management. Accountability and citizen empowerment means there is a transparent interface. We've seen a bit of integrated systems that have, for example, dashboards, GIS capability, giving reports, providing oversight and reporting to stakeholders, providing feedback and grievances and appeals to multiple social protection practitioners. The other aspect to think about is also digital innovations. I think there's a fundamental shift to move towards, for example, using integrated systems to be able as services, so that when government makes an investment, other non-governmental organizations, other practitioners could be able to layer additional digital systems and platforms on top of the integrated systems for information management. So what are the main components and pillars of integrated information systems? So on the paper, we go into a lot of length and breadth in terms of what are the components. We know very much components in terms of the ICT infrastructure. We know the software in terms of the interfaces that we normally interact with. We know the registry and the databases, but I just wanted to focus a bit in terms of the brainware as well as institutional settings. In terms of the brainware, I think less emphasis has been made previously in the previous researches. But in this particular respect, it's very key for social protection practitioners, especially setting up integrated information system for information management, to focus on getting skill sets and building competencies across a broad range of areas. And the critical areas normally include, for example, IT is one aspect. That is a team of people needed to be able to manage the information system. We also need people who have a very good understanding in terms of operation and delivery of information system, more or less like the business analyst skills. We also need people to be able to make sense of the data, analyze the data, statisticians, economists. And finally, we also need people who are able to actually showcase, more or less like sell or ensure that there is ownership and the buying in terms of the use of information systems. In terms of the paper, we go into greater length and depth in terms of the 3 pillars. And the first pillar is on the program, operations, and functions. The second pillar is on integrated operations and functions. And the third in broader registries and information systems. So let's look at each of that. So in terms of program operations and functions, I think most of the social protection programs follow a social protection delivery chain, starting with outreach and registration, followed by assessing the needs and conditions, eligibility and enrollment, payments and service delivery, grievance and appeals, beneficiary management, and monitoring analytics. So across every of this particular delivery chain, you could set up an information management system to computerize or automate any of these particular functions. So when it comes to outreach and registration, some process can be put in place, an information management system to support the data collection. In terms of assessing the needs and conditions, information management systems can be put in place to be able to support the poverty analysis, setting in place, for example, systems to be able to support vulnerability assessment, aspects to do with eligibility determination based on the rules of different programs, payments, thinking about production of the beneficiary payrolls, putting in place, for example, reconciliation mechanisms with payment service providers, grievance and appeals, putting in place, for example, digital mechanisms for registering the complaints or appeals, putting in place, for example, escalation mechanism based on the service level agreements, and ensuring that there is a resolution mechanism. And in this particular respect, multiple technology elements can be actually incorporated. When it comes to beneficiary management, you're talking about compliance management, updates to beneficiary details. Beneficiaries die, they may change their addresses. There would be need to think about recertifying the beneficiaries, the case management, and the exit. And across every of these particular function is you'd have a monitoring and analytics function. You can get a report against every of these particular processes. So that is dealing with one particular program through the social protection delivery chain. In an integrated setup, you have components. Every element effectively within the integrated setup could be integrated or turned into a setup that can work for multiple programs. So if you look at it this way, for example, when it comes to eligibility, registration, and determining the conditions, we actually think about a component called a social registry. So a social registry is a tool, if you like, that can enable the registration of multiple households, ranking in terms of their needs, and sharing that information with multiple social protection programs. So in terms of the functionality, it's critical to think of social registry as addressing the outreach and registration and assessment of conditions and needs in terms of the social protection delivery chain. When it comes to payments platform, this is a platform that is used to manage payment delivery and linkages to payment channels for multiple social protection programs. So you could have a function integrated for information management, specifically tailor-made on payments function alone. And when it comes to grievances and appeals, again, a social protection sector, a digital grievance and appeals mechanism can be put in place for registration, escalation, resolving complaints and grievances within social protection sector and even beyond for multiple programs. And for beneficiary management, again, the similar case. You have the capacity to be able to address updates, to be able to address the case management, and to be able to address the recertification for all beneficiary-related issues, not for one program, but for multiple programs within the social protection arena. And then we have the Integrated Beneficiary Registry, which is a warehouse of information for reporting, for analytics, and for planning. Again, relates very well to the data analytics and reporting component within the social protection, within the program social protection delivery chain. So just to emphasize here, often the functions in an integrated setup are driven by common business processes. So weaving these functions in an integrated way means understanding the institutional setup and how the different programs actually operate. Think about the policy and institutional arrangement, and then information management elements for one or more programs within the delivery chain can be integrated to serve multiple programs, yielding greater outcomes instead of one program actually functioning by itself. And then within the third pillar, we actually look at the broader registries and information systems, and there are effectively about 6 key aspects. And why do we think about that? Because by linkages to the broader registries and information systems within the other sectors, we enable verification of applicants, for example, with national IDs. We enable the provision of critical information for determining eligibility or certifying beneficiaries, extension of services to social protection beneficiaries. So I'm going to just mention a number of these particular registries across the third pillar. We have the national ID, which provides the capability for social protection programs to be able to verify the authenticity of the applicants, especially using automated mechanisms, for example, APIs. We have the civil registration systems, again, be able to deal with the live vital events, the births, the deaths, marriages, and all that. Again, very, very critical, considering, for example, most social protection programs target applicants or beneficiaries across the life cycle. For means-tested programs, they may be need to link to the tax registry or land registry to be able to verify the income of the applicants or potential beneficiaries. Education, health, and social services, linkages could be there, but there are potentially sometimes challenges, especially in terms of the privacy, especially when it comes to linkages to health-related information. But social services provide, it is not just providing information to social protection, but extending additional services to the beneficiaries of social protection programs. GIS presents a very good opportunity. Anything that you can be presented, for example, in the charts or tabular format, can be presented in 3D using GIS, and it presents very strong function, for example, for planning. So when it comes to integrated systems, having a layer of maps and linking that to beneficiaries, linking that to, say, payment service providers, provides useful way in terms, for example, measuring, for example, performance of, say, for example, payment service providers. So GIS is a very strong component that can be linked to. Equally, the social protection sector could also, or systems could also link to humanitarian and disaster risk management systems. So I think we are discussing a scenario where we now have a global pandemic in terms of coronavirus. But in many situations, for example, there's been a lot of discussions, especially among social protection practitioners, to link social protection systems to be able to respond in case of a shock, either by providing top-up allowance or having the ability to be able to respond quickly in case of an emergency. So what are the critical design questions when you're putting in place an integrated system for information management? So there are 9 questions that you need to be able to ask and be able to answer if you want to actually put in place a very strong integrated and digital information system. The first question is, what are the functions and the data flows that need to be prioritized, and how design choices ultimately respond to the needs of the users? And in this particular case, the first question would be, do these particular programs want to have a system for one specific program? Is there a need, for example, to have a gateway or processing the needs for multiple social protection programs? In other words, for example, thinking through a social registry. Is there a need, for example, to have the data for planning, for monitoring the entire social protection sector? So those are critical questions when it comes to the data flows when you're constructing a digital and an integrated information system. Then the second question would be the outreach and intake strategy. Thinking through, for example, will there be an on-demand registration? Will there be need for census? Will there be need for mass registration? And then the other question would be the percentage of the population, especially if you're putting in place, for example, a social registry. Do you want to target, for example, 50% of the population? Or do you want to reach, say, the entire population? And then whose data is collected and stored, and what's the potential for exclusion explicitly addressed? So there are multiple challenges, especially when you put in place integrated system, because the biggest risk is you can create a single entry point. Therefore, the ones that are not in the system could easily be excluded. So strategies have to be thought of how to address those particular challenges. Then the other aspect is data verification, validation, and storage. Thinking through how do you ensure that data is cleaned, what mechanisms are put in place to ensure you validate the data for accuracy. And then the other critical question, of course, is that data is collected, collection of the data and storage. What mechanism is needed to be able to collect the data? How frequent, often is that particular data stored? Considering that, for example, some of the data variables that you collect could quickly, for example, become outdated. The seventh point is data used for monitoring, evaluation, accountability, knowledge management, evidence-based making. So thinking through what parameters and variables would be needed to be able to support decision making, to be able to analyze, to ensure that there is an element of accountability within the entire social protection framework. Interoperability is very, very key. Thinking through, for example, data sharing protocols, how is that operationalized, any legal framework that needs to be put in place, any laws that need to be thought about, do we bring together, for example, coordinate with all the actors responsible. And of course, privacy and security is very, very key. I think within each and every individual program information system, it's very possible also the risks to say privacy and security are still relevant. But when it comes to integrated systems, databases holding, for example, millions of records of beneficiaries, the risks are actually exacerbated. So thinking through exactly the mechanism to be able to address that. So what are the challenges? Digital and integration, yes, great, but it comes with a number of challenges. The first challenge is for most of the developing countries is starting too big in a setup where the delivery systems are still evolving. So the biggest headache is, do you do a phased approach to putting this in place? If you actually start very, very big, the chances of actually failure are also very high. So it's thinking through that critically. Complexity and cost, budgeting very carefully about the risks, about the complexity, thinking through the time and the cost required to be able to set it up, to maintain. We've got, for example, a large project in the UK that cost a lot of money, $10 billion US, which was being designed for the National Health Service, and it was abandoned after many years of actual investment. So thinking through exactly what would be the cost, putting in place, for example, needs assessment and feasibility study to be able to address that particular challenge. Coordination and data politics, very, very real. Data comes with power, and you may have a bit of silos. And in many countries, for example, social protection is delivered using multiple ministries and agencies. So bringing together all the actors to ensure that you have an integrated system means actually doing a lot of coordination and addressing a lot of data politics. And then there is capacity. Most of these particular integrated systems and in many countries are started with support of donors. So the challenge normally is what happens after the donor support comes to an end. How do we deal with sustainability? Is there a provision, for example, to ensure that the government has more stronger control? Then there is the fifth issue is telecommunication, lack of broader infrastructure in many countries. For example, we have weak telecommunication systems in rural areas that hampers capacity to fully operate an online information system. In terms of risks, we talk about data austerity, meaning I think integrated information system is like a double-edged sword. On one hand, it can give you multiple benefits. On the other hand, it could be used negatively, for example, to sanction and to reduce the investment being made in the social protection sector. The other one is the loss of human interaction. You're talking about digital algorithms, everything being automated, system for the applicants making an application, all that being connected to multiple government systems, cross-checks being done, so there is no human element and compassion, which is associated with other manual processes. Systematic exclusion and profiling. So it may I mean, it may bring about automation of the processes and automatic exclusion of some of the applicants. And I think there's a very strong EU GDPR regulation, which sets out very clear regulation around decisions to do with automated processing and the need to be able to ensure that the rights of the applicants and beneficiaries are protected. That applies to the EU citizens. And then finally, I think data privacy and security, very, very strong. I think thinking through, for example, not violating the privacy of the applicants or beneficiaries of social protection systems because they're poor and vulnerable. So we've seen, for example, some of the sites where social assistance beneficiaries are listed on the public sites. Looks like a place for naming and shaming. So it's very important that as we put in place social protection as a right, that we do not actually violate the other human rights, especially the rights to privacy and confidentiality. Thank you.
Thank you so much, Richard, for whizzing through that fantastically for us. And it's interesting to note that, especially in those last two slides where you were showing challenges and risks, how the challenges are very much of the countries that are in the process of developing these systems, and the risks are the risks that countries that have already developed these systems have found themselves now in sometimes even in big trouble. And there's an important new wave of literature from high income countries on some of those risks, and a very strong report by the UN Rapporteur on Human Rights, Philip Alston, on some of those risks, which I really invite you to go and have a look at. I'm going to hand over the word to Massimo, who's going to now contextualize and talk about Malawi. So please, Massimo, over to you. Thanks, Richard.
Thank you, Valentina. I will try to bring the practical perspective to what Richard has said with the case study of Malawi. We have what we call the Unified Beneficiary Registry, which is more of a social registry. So I'll talk about the key features and the current coverage and what challenges we have faced and the lessons we have learned, but also looking into the future, what do we want to achieve. A brief background of Malawi. It's a country with around 17.5 million people, and the poverty around 51% and ultra poverty 20.1%, and very vulnerable to shocks. We have different flagship social protection programs. We have the social cash transfer program, we have the public works program, the school feeding program, and also savings and loans. So looking at the different programs, the social protection programs being implemented, we moved on trying to build systems. And one way of building systems was to have a social registry, which would try to harmonize targeting processes for the different programs. So we developed what we call the Unified Beneficiary Registry, which is more of a social registry. And the main purpose is to make sure that we are capturing, storing, but also processing data and be able to share that data to project implementation. So we feel this social registry is enhancing and strengthening coordination within the social support programming, but also maybe beyond as we look into the future. It is also promoting the targeting, harmonization of the targeting approaches and processes. In the pipeline, we also would like to see the social registry ensuring that we are tracking the enrollment and the graduation of beneficiaries. So in terms of our features for the Unified Beneficiary Registry, we have some key features which we felt significantly contributed to the establishment of the social registry. One being the government ownership. The The registry was fully developed by government, and there is a strong government leadership in the whole process. In the extent that from the conceptualization, government has been in the forefront. But we also have, I think Richard already mentioned issues of data privacy and security, which are important as we are dealing with people's information. So we have what we are calling the UBR data sharing protocols and procedures. This tries to guide on how we can share our data and make sure that we are protecting our data. On top of that, we also have, since this is digital, we can't run away from the IT-related risks, security risks. So we have IT security protocols and procedures, and regularly we do some security checks of our system. Data is powerful if it's of high quality, and what we make sure is at the point of data collection, we put data quality assurance mechanisms so that the quality the data which we are collecting is of good quality. One of the ways is to make sure that we use the statistics office to help us in making sure that we have the right data quality parameters, but we also do engage independent assessments to check the quality of our data. Richard mentioned of also linking with the national ID. We are also in a process of making sure that we are linking the data, our data with the national ID to ensure that it is of high quality. As I've already said, its development involved a lot of government leadership, but it was more of a collaborative approach, and it was in-house. That is, we used the existing government systems to develop the systems by looking at the different key ministries in social support programs, making use of the available IT skills to come up with the system. In terms of the actual data collection, so the UBR is serving the purpose of the outreach, intake, and registration. There are different methods, but what Malawi opted for is to go for the mass registration, more of a census sweep approach, whereby we are doing a census-based approach, and we are collecting every 4 years. So we make sure that there's close engagement with the communities. We do community campaigns, radio adverts to make sure that the message is sent through to the different communities before we start the data collection. The actual data collection is digitalized. We use the tablets, and also using the ODK, which is an open source software. There are a lot of questions related to socioeconomic data which we use to correct, and these variables were selected in a more consultative process, whereby we first had to engage the potential users of the data to determine their data requirements. For example, the implementers of social cash transfer, the implementers of public works, and also looking into the humanitarian, what are their key data requirements, and from there we came up with what we called a harmonized data collection tool. So we feel this is more of a strength of having a large number of variables. It will strengthen the utility of the data because it is capturing the needs of the different stakeholders. But still, the variables had to undergo some prioritization, and of prime importance was to make sure that we prioritize those variables which are able to predict vulnerability, and also not just any socioeconomic indicator. So just a snapshot of the variables we are collecting. We are collecting more of geographical and also geographical location and household information. These are the basic household characteristics in terms of household members, the age, the disability, the current status of that household, whether it's already a beneficiary of an existing social protection program. But one important variable we are also collecting on that is the geocoordinates. We feel this is very vital. I think Richard already emphasized the importance of having these geocoordinates, because you'll be able to present on a map in terms of the different locations of the households, but also linking it to different services. So we feel the geocoordinates is one very important variable we are collecting, which will help for programming of social support programs, but also even beyond social protection. We are also looking at household characteristics and some assets, issues of home ownership, issues of the types of the house, those characteristics which can also help to predict vulnerability and poverty, and not forgetting food reserves and economic characteristics. So in terms of where we are now as Malawi, in terms of the implementation, we used a phased approach rather than going full throttle. So the first phase started around 2016, and under that phase, we only targeted 11 districts out of 28 districts which Malawi has. And from the 11 districts, we were collecting only 50% of households, and these are the 50% who are being reported by the communities to be the bottom 50%. This was informed by the fact that poverty in Malawi is around 50%. So we concluded that if we collect at least 50% of these households, we are indeed collecting the data for use in our social protection programs. And then the second phase, which now aims to reach national coverage. And for this one, we are using a new approach, which is more of a sense and sweep. And we are collecting 100% data for 100% of the households. That is, we are collecting information for all households in a particular community or village. So on this one, we started in 2018. So far, we have collected around 900,000 households, but we want by 2020 to reach the remaining districts. So if we reach national coverage, that is minus the cities, and adding the first phase, the data which was collected in the first phase, we are approximating to have around 2.2 million households in our social registry, which represents roughly 57% of the households in Malawi. So to link what we have done so far with the three pillars which Richard presented. So we have our Unified Beneficiary Registry, which is a social registry, which at the moment is serving the social cash transfer program. It's also serving the public works program through the API to share the data, but we are also sharing to other programs upon request. But for the big programs in Malawi, those are the ones which we are sharing through the API and linking it to the program MISs. We also piloted to use the social registry to do humanitarian response this year. We piloted in one district, and we shared with the humanitarian sector to do the vertical and also horizontal expansion. We are yet to do more of the analysis and the reporting component of the second pillar, and also make sure that we are getting updates from the program MIS is feedbacking back to the registry. In terms of also linking with the national ID system, currently Malawi has just operationalized its national ID system, but what we made sure is that as we are collecting the data, we collect the national ID numbers, but also scanning the barcodes, so that when later on we can easily link our social registry to the national ID system. In future, we would also like to see it linking it to the payment system. So moving forward, what does the future look like? I think we have two main objectives which we want to see. One is of deepening integration, making sure that we are saving the different social protection programs, but we are also moving beyond social protection programs. Think broader to the humanitarian and other sectors. And the other one is, I think, for data to be of much use and importance. For now, we're updating in every 4 years, but we are trying to look at innovative ways on how we can make sure that we also have frequent updates, maybe moving towards on-demand registration, because we know that other sectors might need data which is frequently updated, especially some other variables that change frequently. So we want to maximize the available technologies, use of artificial intelligence, deep machine learning, and other technologies to enable faster data processing, and as we'll be moving towards more data analytics and security. But also regularly review our data sharing protocols and making sure that they are in line with the existing legal framework around data protection in Malawi. Still, as we were embarking on this journey, we can't run away from challenges. We had some challenges, but we also seen some opportunities and the lessons learned. I think as we are starting the process, because by then social protection in Malawi was more of fragmented programs, implementing specific programs without much linkages. So we had to do a lot of discussions, especially with our partners, to make sure that they fully understand the vision around social registries. And despite that, the development was more of government-led in terms of the conceptualization and the actual development, the IT system, but the financial support mainly came from donors. But so looking forward, we want to make sure that there's government ownership even in financing. We have seen a lot of increased demand now for data requests, yet our system is not fully customized to make sure that we save different requests at once. So we will also make sure that our data sharing protocols are fully institutionalized to save the people who need the data. But I think one key strength we have seen with our system is I've already mentioned the geo coordinates, and the system has also been developed to make sure that it's interoperability with other systems. In mind, we are keeping the national ID system, but in the future we are also thinking about the payment system so that we can easily share information. And the existence of the API is one of the areas. So some of the lessons learned, there's a need a lot of collaboration, a lot of coordination to to have this on the ground, and there's also need a lot of system thinking before we actually roll out. So that's the end for Malawi case. Thank you.
Thank you so much for being so comprehensive and yet so clear. That was really amazing. Thank you, Massimo. What I'd like to stress also from the way that Massimo told us the story of the UBR in Malawi is this idea of a trajectory. And if we can go to the next slide, what's important to understand in terms even of the overarching framework that we have and that visual with the 3 pillars that's going to come back on the screen in a second is that we should imagine each of those elements as pieces of Lego, not as pieces of a puzzle. We don't necessarily need our system to look exactly like what we have here in this visual. So this is, in a sense, it gives us a vision of what we could be doing if that is what we're trying to achieve. If we're trying to achieve full integration, if these are the building blocks that we actually have in our country, this is what our system might look like. But if we view them as pieces of Lego rather than pieces of a puzzle, that means that those different pieces, depending on what we have in country, we might be joining them together in different ways, having information flowing in one direction or another, maybe starting with one function, one component, and then slowly building in order to achieve other functions. So in Malawi, for example, they've started from a social registry function and are slowly moving towards trying to achieve also an integrated beneficiary registry function and slowly integrating other government systems as well. So having said that, I wanted to turn towards the panelists because we're going to have 3 quick questions before I open up to the audience questions, which I've been collecting. Please send some more. I've been organizing them and I'll be posing them to the panelists as soon as we're done with this quick initial panel discussion. So I wanted to ask you, and Massimo in a sense has already answered this question, but maybe Richard also with your experience from other countries, whether you could give us a sense of where you've seen this trajectory in place of people kind of looking at countries, looking at their context, looking at what they have, and then kind of slowly building from there. Maybe Kenya, given that you're so familiar with the case.
Thanks, Valentina. So yeah, I mean, I think there's been a very strong shift in the past 10 years anyway to move towards integration. I think, but different countries.
Give us your video, Richard.
But different countries are starting at different points. So in Kenya, for example, I think 5 to 7 years ago, based on the policy framework that was already there, Kenya started on an integrated beneficiary registry, which was called a single registry. And it started by linking 5 social assistance programs: elderly grant, disability grant, old age pension, WFP, one of the social assistance programs run by WFP, and the Hunger Safety Net program. And then progressively, there's been a recent discussion to now put in place a social registry. So Kenya, for example, is having a bit of this piece in the middle. Started with the integrated beneficiary registry, and then now it's building a social registry component. In other countries, for example, in Uzbekistan, they have an integrated beneficiary registry, but their linkages to the 3rd pillar connects to 13 government databases. So very, very strong lands, tax, and many others because they're doing a means test to verify the income of the applicants before applying the eligibility. So different countries start different, and they started very interesting because Uzbekistan started fairly recently, 2 years ago. I mean, they did have visibility maybe 5 years ago, but then started really aggressively moving 2 to 3 years ago with a very strong cabinet of ministers resolution that underpinned the entire design and ensure that all the bottlenecks, especially institutional ones, were addressed with this strong legal framework. Other countries, Uganda, are building the piece we call the integrated beneficiary registry, while others have different levels of configuration. So we know, for example, Liberia and others are starting building on the social registry aspect. And in some other countries, there is a bit of a discussion of what elements, other elements you could start with before actually moving. So I think, thanks, Valentina, that should give a bit of an idea of that different starting points, different contexts, different assessments, and different policy direction by different countries.
Great. And I'm going to open this also to Massimo and Ralph. It's in general, I mean, as we've seen, building a fully digital integrated system requires a lot of coordination and a vision. But how do we get there? How do we not get stuck looking at just one program, one sector? Are there any common building blocks, common entry points? Do you have any comments on this?
Massimo, do you want to go first?
Yes. You are right. It requires a lot of coordination, but I think what is also important is the visioning itself. For Malawi case, I think because of strong government leadership by then and the visioning at the conceptual level helped to have the necessary steps for takeoff. And also the initial thinking then started within the social protection program. First looking at the social cash transfer program, but now extending to public works program. But what we have seen is that the social protection sector is growing, and there's a increased demand for data for the different programs. So it also requires to have an open mind, not just being thinking narrowly in terms of, for example, saving a few programs, but making sure that you are moving to the different needs of the social protection. For example, nowadays there is more talk towards shock sensitive social protection, and already that requires a lot of dynamic inclusion, a lot of updates. So if we are stuck to say we'll still be doing the census sweep approach every 4 years, it will not be of much usefulness to the shock responsive social protection. So we still need to be thinking as we are building the different blocks. Sure.
Fantastic. Thank you. Ralph, do you want to add something?
Yeah, maybe just very briefly. I think that the political leadership obviously is important, but also at times it is important to have, as Massimo said, that joint vision, and that's also where that publication and these 3 pillars are meant to contribute to essentially have different ministries and different agencies supporting these ministries, jointly having this bigger picture beyond, the single program they're looking at, and then to see how different pieces can fit together. What I think is important beyond is, however, to always remember that technology is meant to support program delivery and make it more efficient, and make it serve the people better. Also the interconnection between programs, so that you can purposefully also combine programs or keep them apart as you need it. Which also means that at times it might be good not to always remember, when you're trying to have that bigger vision implemented, to not rule into the implementation of programs, but rather say, this is what you have, and we accept that you function the way you're functioning, and we'll try to integrate that into a bigger picture also on the technical side, but not to tell you how you need to do your business differently. And I think that lowers resistance also of, essentially interconnecting the various programs better. The debate on how programs do relate to each other is not a technological debate. That remains a political debate, and that's cannot be sidelined on the technological side. I think that's important to bear in mind.
Absolutely. And building on that, there's actually a lot of comments that are coming from the audience that we're going to come to in a minute. And even again, based on what Massimo and Richard were saying and what we wrote in our paper, ultimately, okay, we might have a system that performs all of these functions, but even the specific way in which those functions are implemented actually has a massive impact on what we can achieve or can't achieve from a policy and operational perspective. And there's a large variability in some of these underlying design and implementation choices. So take, for just as an example, if we go back to the visual of the 3 pillars, if you think about your social registry, Massimo was talking about even over the course of the last few years, how Malawi has shifted towards kind of more comprehensive approach to registering higher percentages of population, but again, only in rural areas and by census survey every 4 years and not on demand. So those differences have massive implications in terms of the outcomes of our systems and, for example, exclusion outcomes. Do you have any comments on that based on your experience? And then we'll go into a few specifics as well. Richard, do you want to go first? Oh, you're muted.
So I think I think the critical issue in terms of the thinking through these pillars, I think when we conceived it, is the element of the flexibility. I was actually thinking, one critical issue that many people will ask is, so when you have the integrated pillar number 2, and you have integrated operations, where do we have that in the real world? And I was going to give going back to Uzbekistan, in this particular integrated information system, where 6 programs are being, application is done, which seem in a similar aspect to the social registry functionality, but the payment delivery is done for entire 6 programs: appeals mechanism, beneficiary management, and the integrated beneficiary registry reporting is also done. So you could have it. I think the key is it goes back to the objectives, the vision, the legislation, and what we call actually the institutional setting that we actually set out from the start. Once that is there and the commitment, it's normally easy to move the steps once you have that. So in a way, for example, I've seen many countries, if you actually put this particular pillar, it should be very easy to be able to assess where they are in terms of the status and potentially also the vision. And I think that was the whole idea behind this particular framework or concept, was to always say, if you take these particular 3 pillars and place it within your country, where are you currently? What is your current status? And are there things that you could do to improve existing? Use it as an assessment checklist, but are there things that you can do to be able to improve your integrated information management system for the better? And it may mean, as Valentina already said, that it may just mean working on one subcomponent progressively, because different countries at different stages, different political economic considerations, different politics, different priorities, different investments in social protection. But in the end, we all want a shock responsive system. We want a functional, we want an inclusive social protection system, and we want that underpinned by a very strong information management component. I may not have answered the question directly, Valentina, sorry. Yeah.
Does anyone else want to say something on this?
Nothing to add from my side.
Yeah, I think let me comment a bit about this. Valentina talked about issues of exclusion, issues of collecting data, for example, every 4 years. I think you have rightly put it to say this is more of a trajectory, and for example, for Malawi, in the end, we want a system which is dynamic and inclusive, but still we had to start. And by then, the conceptualization and the objectives was to serve some flagship programs within social protection program. So we had to make sure that those target programs, we are collecting data and we are as inclusive as possible. So for the social cash, because it's a program whereby the beneficiary stays in the program for a longer period of time. Once you have enrolled, you have to be in that program for a certain period. The same applies for public works, whereby they use a repeater beneficiary. So we thought, as we are starting collecting at every 4 years, and focusing in the rural areas where the programs are targeting, we are minimizing the exclusion, but we are making sure that we are being inclusive enough. But as I've already said in my presentation, moving forward, we are thinking innovative ways on how we can do maybe on-demand registration, how we can make sure that we are frequently updating our data so that we serve the wider platform, also including sectors beyond social protection and humanitarian sector. Yeah,
fantastic. And as a piece of news, there's also a forthcoming GIZ paper, which is going to look specifically at different approaches to on-demand registration and what the kind of advantages, challenges, prerequisites for each of those is, either kind of to complement, for example, or to completely substitute census survey approaches. Right, so the time has come to shift to the questions from the audiences, and there's a lot that are coming in. The bad news is we probably won't manage to cover all of them in depth, but the good news is that we here solemnly promise to write up written answer to every single question that you pose. So do not worry if you don't hear an answer from us today during the webinar. We will be posting answers in the follow-up to this webinar. So let me start. There's a few interesting questions on some of the topics surrounding risks, unsurprisingly. There's one interesting one. I'll just pose 3 of them to you in together, and then the panelists can choose how to answer. One on the trade-offs between the right to privacy and transparency, and then specifically accountability, for example, and how that has been faced in countries. A question on where is there a way that countries can actually check whether some of these potential risks that we've been discussing are actually occurring, and at what point, how could they base a decision on whether the risks are too great compared to the benefits, and potentially even abandon a project. And we made an example from an old NHS information system that actually got abandoned because of the risks were too high. If there's any thoughts on that. And there's rightly enough quite a lot of preoccupation, especially in the context of social registries of systematic exclusion. I'd like to just repeat here that the same risks that we have when we're integrating the gateway function of registration and assessment of needs, that same risk happens at program level as well. So the issue with integrating that function is that we're consolidating that risks and potentially excluding people from all social sector programs because of that integration of that function. But the underlying risk is the same at program level or at integrated level. So there's questions around, especially given we've been talking a lot about IDs, what about vulnerable populations who don't have IDs? What about digital illiteracy, and how does that pan out in the context of such a digital system? I'll leave the floor to you for these questions for now.
I'm happy to pick a few if you like.
Go for it.
Good. I mean, as you said, that was a good starting point. I think the risk on many of the aspects is similar to an integrated system and to a data management in separate systems. And I think that's really important to bear in mind. I mean, it's not that the risk to privacy and so on is less if I spread the information of people across 8 different databases and or semi-professionally managed systems. So sometimes it can be better to have a focused approach, like in Malawi, there's a technical task force, for instance, looking in some of the aspects, which is, I think, a step in the right direction of being professional in terms of data management. It does not mean that there is no risk. I think there is important to have to get some clarity on transparency, data protection, and so on, and how to handle that in terms of processes, who can assess the risk. And I think that's often not as coherently taken up as we'd like to see it. There is increasing movement in that. I think there is also discussion at the international level, but also within many countries on how to improve that. And I would assume there is more sensitivity, on that issue coming up, or it's also more looked into. The question on inclusion, exclusion, and these issues, I think such a system in general, apart from being an on-demand, having an on-demand approach to appeal, you need a strong grievance mechanism built up along with that. But I think that, and it's seen even in the illustration here in the second middle pillar, you can think about establishing a grievance appeal platform, which can also across, basically get some information and approaches pulled together across platforms, and also make the voice of people heard better, follow-up made better. And I think that can work well. The IDs themselves, there was a question on whether what happens to people with no IDs. They are not necessarily a prerequisite to get into such systems. I think also Malawi, as Massimo will be able to confirm, started prior to the rollout of the national ID. Then the systems might need to create some. At the end, IDs are important to give people a unique identifier to, basically go between different databases, and to be able to move that information into interoperability. For that, it's important to have some identification. It doesn't necessarily mean you need the national ID. It makes it simpler, and it's a good starting point, but it's not a prerequisite. I'll leave it on picking some of the points here.
Valentina, maybe just an addition.
Oh.
Yeah, just an addition to what. Just an addition to what Ralph has said. For the issue of exclusion vis-a-vis the national IDs, yes, when Malawi was starting it, we didn't have the national ID systems in place, but for now we have the national ID system. But a national ID system card is not a precondition for one to be registered into the UBR. So we are still registering even those who don't have the national ID system at the moment, because we know that even the national ID system is still being worked upon. It has just started yet. But what we are making sure is that for those who have the national IDs, the necessary information, we collect it so that we can easily integrate the two systems in future. More of a unique identifier, which is the national ID number for us. The risks of data protection, yeah, I think for us, we are taking it seriously. That's why in our challenges, we also said we have received increased demand for data, but we are making sure that we don't just share the data to anyone, but the data sharing protocols are clear, so that we make sure that before we share the data, it has gone through thorough appraisal in line with the data sharing protocols, and we are still improving them to make sure that the security and the information shared, we maintain the privacy of the people. We are even involving the legal people to help us to look at the issues of data sharing protocols.
Yeah, thanks, Valentina. Let me also chip in with a few points. I think for me, I would just say, I think when building an integrated and a digital infrastructure, I think it's also good to be able to have a mind shift in terms of the data privacy and security. I mean, so that it's not, I think the problem I've seen in many countries is there's a bit of less tendency. I mean, if you're dealing with a bank account for a middle income person in a country, there tend to be a lot of security and all that. So the same approach should also equally be applied to when dealing with that. So it may mean getting informed consent, thinking through, getting legal advice. I think there is a bit of some thinking, for example, in the registry design in Kenya, to be able to get someone who is a specialist on this particular area to think through the entire chain from the point of collecting the data, what aspects of data privacy needs to be put in place, cross checks against other government databases, what consent do we need from the beneficiaries, how do we structure that particular consent, do we divide it, say, for example, for say you can share my data with this particular agency, government agency, and not say NGO and so forth. And then finally, of course, the very strong data protection protocols, and of course also the security, because as we said, I think in the paper, all these particular challenges get exacerbated when you actually integrate large data, but they exist, again, they exist in individual program operation. Yeah.
Fantastic. Thank you. And I'm sure again in the written answers we can add a few more details. I'm gonna I've grouped a few other questions in another conceptual category, which is around data flows and data sharing. And there were questions around what about countries that don't have national IDs? What are the options in those contexts? Just a quick one on that comment on my side. The World Bank's ID4D page has got some very useful materials on the increase of digital identification in many countries and the risks also that come with that. And even in previous write-ups, we talk about how it is possible to have data exchange without in digital IDs, but with, of course, less precise methods, algorithmic data matching. That's the long and the short answer. I'm sure our panelists can add some more details. Some questions around cloud-based solutions and questions also about data politics behind the sharing. So any comments on those topics? Data is power. Information is power. How do you convince people to share? There was also a specific question actually for you, Massimo, on who was the leading ministry for this integration and did they have the traction to be able to pull this off? How they did that.
Okay, let me give it a bit of a pass. Okay, so I think in terms of the national ID, I think Malawi is a very good example of a country where integration agenda started moving forward before the national ID was finalized, as I think Massimo said. So I think, and similarly, I think we know Brazil's Cadastro Único exists despite multiple forms of IDs in Brazil. So I think having a unique ID and having linkages is great. And I think Turkey is a very excellent example in terms of what potentially a unique ID across the entire life cycle could do to support integration, not only FATCA. But I think how to approach I think ID and those having and not having is a broader social protection issue. It does affect integration, but I think it needs to be addressed broadly across social protection, because if you make policy, if programs make policies to say, for example, no ID, no access to particular benefits, there might be significant disadvantage to particular categories. So I think, but within integration, I think sometimes registries present an opportunity to be able to generate some number that could then be used, especially the social registries. Cloud-based systems, interesting. This really depends on broader ICT governance in the country and what the country wants. Some countries allow their data to be kept outside their boundaries. Some countries have private and public clouds within the country, and it's very good sometimes to consolidate instead of actually building the old hardware infrastructure or data centers. Sometimes it's better to actually work with clouds. The key is just to know exactly what it means in terms of the data for the beneficiaries and whether you've actually done proper investigation in terms of the ICT governance within the country. Because your program could be shut down because somebody actually understood it differently to mean that the data of the vulnerable population is being kept elsewhere, it could easily be misconstrued. And finally, data politics, very, very key. That's why I think we always say, I think Malawi, again, very good example, Ministry of Finance led, Uzbekistan, Ministry of Finance led, another very stronger ministries, because, I mean, you have to, I mean, where there is a very strong silo and multiple agencies, you want to ensure that there is a ministry responsible for governance and leadership of the entire integration and digital agenda, as the requisite power to be able to pull everybody together on the table and make things moving. Yeah, thank you.
Yeah.
Anyone else? Massimo, yeah.
Yeah, I think I'll focus the one which was about who is leading in Malawi. So I will briefly explain the whole institutional setup for the social registry. So we have the Ministry of Finance, Economic Planning and Development, which is the policy holder for social protection in Malawi. So they are the one leading the whole process. And under it, for the daily operations, we set up what we are calling the UBR management unit. So under that, we have technical staff, more of IT staff who look at the social registry day in, day out. And besides the UBR management unit, we also have what we call the UBR task force. And this is a multi-sectoral team, not just from the Ministry of Finance. It also includes from the key sector ministries who are more of the users of this social registry. So we have people from the Ministry of Gender, Children, Disability and Social Affairs, people from Ministry of Health, and other sectors, mainly the IT team, who regularly meet and also support the UBR management unit, bring in new ideas and also making sure that everything is on track. For the broader policy and other implementation things, we usually hold what we have a UBR forum where we usually hold UBR coordination meetings. So under this, we have both the IT experts, we also have the program implementers, and also the ministry itself and the development partners, where we discuss now the key technical issues regarding the UBR. So at national level, that's more of the institutional setup. The Ministry of Finance leads, but in close collaboration with the sector ministries who are the users of the social registry. Yeah.
I think that nicely sums it up in terms of having an agency which is not necessarily a direct implementer, but more really in that coordination role, so that not the interest of one implementer conflicts with the interest of the other implementers, but doing it you know, in a way that it involves the implementer and gives them a buy-in and a say in the overall in the overall aspect, which obviously is critical to the execution of their programs, you know, the data side.
Yeah, the 2017 World Bank paper on social registries for social assistance and beyond has a nice section on institutional arrangements across countries for those who want to go and have a further look, specifically focusing on this gateway function. So I'm gonna, I think it might be my last round of questions. And again, apologies for the ones that have been left out, but we will be coming back and providing written answers within, let's say, the next 2 weeks max. So in fact, actually, there are two last groups of questions which I'm going to pose, and I guess you can choose to focus on what you want to focus on. There's one around the financing, kind of how much it costs both to set up such a system, to keep it running, the fact that donors have been behind the financing in many cases, so how governments, and for in this case Malawi specifically, kind of hopes to be able to sustain this in the long term, and also questions around in-house versus kind of outsourced approaches to developing such systems. And then a second group of questions around kind of social registries very much often being focused on kind of being household databases, kind of looking at households rather than individuals, and they're often primarily serving poverty targeted programs, and in a context where countries might want to be moving towards universal categorical programs, would social registry still kind of need to play a function, and what your opinion is on that? These are big ones.
Well, I can maybe quickly start on some elements. Households versus individuals. Think it if you want to set up a social register, it's wise not to describe how to keep the options of users as open as possible. So a register which essentially has information on individuals can be used both for poverty targeting as well as for other programs. I think that's actually a desirable way to go. That it requires a good dialogue beforehand on a harmonized questionnaire and how you want to structure your data, and that's in my view the key to making it a broadly accepted central piece for a information system. Without a dialogue, it only serves a few programs, and when it serves few programs and that links to the financing question, there are also few programs interested in financing it. The broader the user base, the broader the pool of resources available for maintaining such a system, and then it can actually be cheaper than going out each program alone and doing certain targeting efforts, and can also be more professional in terms of the IT maintenance and so on behind it. So I think there is a benefit, or there is an option at least for some resource pooling which comes out of that. In-house versus external development, I would always advocate for a government having a strong knowledge of the core IT systems, which are the backbone of their social programs, and therefore it is beneficial if there are in-house IT specialists which are working together where need be with external specialists, experts, who contribute a bit, but that being done such that it internalizes, some of the knowledge of the external expert as well, and that you always have a good pool at hand, which can always keep, the maintenance and updating of the software going throughout.
Yes, some more additions. I think I'll start with the in-house and out-house. Malawi considered, before it started, considered those two options, whether we go in-house or out-house. I think some key findings of that was that why we opted for the in-house is because we found it to be a bit cheaper in terms of the cost rather than outsourcing it. But it has longer-term benefits, also issues of sustainability. There's strong ownership of the system. So we felt that's a better way to go. In terms of financing, I think Raf already touched about it. If you look at the individual programs doing their own parallel targeting approaches and consolidated the costs, you find that using the social registry approach, it's way much cheaper. But at the same time, for Malawi, we are not, for example, relying on using one donor to support the whole process. There is more of resource pooling. For example, one partner supports more of the IT backbone thing. The other partner can support the actual data collection. The other partner can support the other part. So once these partners pool the resources together, it is more cost effective.
Yeah, just a few comments building on what my colleagues have already said. I think number one, in terms of the financing, I think we did mention the case of ESAS in Turkey, which I think the information is public about the cost of building the system, $13 million US, and the savings. The system has been used to actually deliver benefits up to about more than 13 billion USD. So if there's a saving on duplication of 10%, you can see, for example, the economies of the value of such an investment in terms of the infrastructure. I'm very sure the cost also could be looked at differently. There could be the cost of setting up the information management component. There could be the cost of collecting the data, which would be very, very different. Outsource versus in-house, I think it depends on the country, the capacity of the country, and the choice. In Namibia, for example, the Office of the Prime Minister has a very strong IT department with more than 100 resources. In that country, for example, building an integrated information management system, outsourcing may not be the best option because there's a lot of capacity built over more than 20 or 30 years, building systems within government. While in some other countries, it may make sense to go out there and get the private sector expertise. Social registries, I think the key issue is it's a very interesting debate because I think it depends on the functionality. I think I've debated Valentina, I've debated the World Bank and others on this for a very long time. I think that the point is, I think social registries, the entry point initially was poverty-based household programs. But if you look at, say, a country which has life cycle based programs, and they have institutionally one agency responsible for delivering social protection, they will still have an integrated system for information management. South Africa, SASSA, is a very good example in point. There's still a gateway. There's still a gateway for applicants to make the application, whether it's a child grant, disability grant, old age grant, and all that. In terms of the function in this particular paper, those functions correlate to outreach and registration and assessment of needs. But it's not necessarily so. You could have registry entry point, which are based individually, driven individually initially by individual applicants, or you could have those which are driven initially based on households. Again, it's informed by bigger political economy discussion in the country, social protection approach, multiple other factors, so that in the end, the integrated information management element just comes in to respond to that particular bigger need. Because I think, yeah, it's not going to be, it cannot be seen in isolation.
Absolutely, and just to add to that, there's not many countries that do this, but there's of course options for kind of purely universal categorical programs to be solely leveraging information, for example, from civil registration systems. So you have the Mongolia Child Grant Program, kind of in a short period of time, they were leveraging civil registration. Kind of every new child can be given a grant, kind of a purely 100% universal program. There's many programs where you can use civil registration to trigger registration, kind of alongside some additional collection of information. For example, even just the practical information of bank accounts to be able to enroll citizens. And there's many programs around the world where information from civil registration and other individual databases, for example, on disability, are used to complement, to validate, to kind of existing information. So there's many levels, and I think we should definitely move towards, especially in countries where we do have these purely universal programs, towards leveraging our civil registration and existing individual based databases, including also death registration. Again, many countries use these to weed out people who have died from social assistance programs, and those are based on solid systems for death registration, kind of strong incentives to do so. South Africa, again, is a good example of that. So we've reached the end of our webinar. There's still a lot of unanswered questions, but we will be providing answers, hopefully, and we hope ultimately that this kind of creates a basis for future discussion and for just brainstorming on where you might want to be going to, what based on other countries' experiences. You can find case studies on past country experiences in past papers. We'll be also providing links to those. There is a lot of information available on the online community on social protection information systems on socialprotection.org. So if you want to know more, please join that. Thank you very much to our panelists for your great presentations and Q&A, and we'll follow up by email. Thank you. Bye, everyone.
Bye.
And good luck with coronavirus.